Hi, we are a startup FimbleFits. We are basically revolutionizing patient follow-up with our innovative chatbot services. So the problem which we are addressing is a lack of patient follow-up. So basically what happens is when a patient visits a doctor for consultation, the doctor gives medicines and the patient goes home. So during this time, the doctor doesn't know what is happening with the patient, whether he's getting ill, he's getting better or not. There is no way of communicating with the patient except for phone calls, which is very cumbersome. So this problem is faced by doctors, clinical researchers which are doing clinical research, and pharma companies also during the trials. So the solution which we have is a chatbot based remote patient monitoring platform. So we have two parts here, the patient side and the doctor side. The patient in the patient size, there's a WhatsApp chatbot basically, which is an automatic chatbot which basically asks questions about from the patients about his health, how is the medicine effective or not, etc. If the patient is having any problems with the health. So on the doctor side, the moment patient feeds any kind of data, which is a plain English kind of data, the doctor receives that data and takes actionable insights, right? Actionable decisions. So the here you can see the chatbot, which is a WhatsApp, and the patient is interacting with it. So this is true for any kind of disease, but we are especially focusing on mental health right now, where we're exploring these large language models, basically the AI which we have, which analyzes the English language, and we are trying to look for the depression diagnosis. That is, if a patient is interacting with the chatbot in a plain English language, can our AI detect whether the patient is depressed or not? So for such kind of clinical study, what we need is a set of depression patients which are known to be depressed by a clinician and a set of healthy patients. So suppose we plan to have 100 depressed patients and 100 clinically healthy patients. So we will be giving them the chatbot, which is just a WhatsApp link, and then we'll be asking them questions on a daily basis. How are they doing? What is their uh, how are they feeling, etc. And the idea is to use our AI on these chats to basically predict whether to give a score of depression score for these each of these persons, and then we plan to see that whether the AI can distinguish the depressed person with the healthy person based on this AI. So for this we plan to basically have a collaboration with our AIMS. My co-founder is an AIMS professor, where we will be recruiting these depressed patients which are known to be clinically depressed and the healthy patients, giving them the chatbot, which is basically free chatbot, and then extracting the AI. So this is me, Rajat Anand. I have a PhD in computational biology, big data analytics, and drug discovery diagnosis, and Dr. Suman Das is right now, he's a dual PhD in neurophysiologist and currently an assistant professor at AIMS. Thank you.